And here at home, concerns are growing as the CDC says more than 24 states are reporting a rise in COVID cases and an 11% jump in hospitalizations. This comes as millions of COVID vaccine doses could go to waste as the vaccine rollout slows down. ABC News contributor Dr. Alok Patel joins me now for more. Dr. Patel, Germany recently reported that it may have to discard 3 million doses of expired COVID-19 vaccines by the end of June because demand there has slowed down considerably. Now U.S. health officials are saying that could happen here too. So what does that tell you, and what are the repercussions if that does happen?
Well, good morning, Diane. It tells me that we completely misunderstood how deep the hesitancy against vaccination would really go during this pandemic. And it strikes me as a massive loss and just a stark reminder of the amount of privilege that we can live in these developed countries. And to think that every one of those shots that may potentially go expired, go wasted, is a life saved, is a case of long COVID prevented, is a case of transmission to someone vulnerable prevented. It's just atrocious. I don't think any of us could have prevented this. And now we're staring at hundreds of thousands of doses in multiple states going to waste. I think we really have to take a moment and reflect on this and think about how we're going to prevent this in the future when it comes to another pandemic, when it comes to another situation where we're staring at global inequity with vaccination, especially right now on World Immunization Week.
Now, according to the Kaiser Family Foundation, since June of 2021, an estimated 234,000 COVID-19 deaths could have been prevented with vaccination. 60% of all adult COVID-19 deaths since June of 2021. So how do they establish that data, first of all? And how do you think numbers like this will evolve as we keep fighting this pandemic?
Well, we established that data by looking backwards, at looking at the amount of people who were vaccinated versus unvaccinated and who was actually hospitalized, and simply looking at the fact that if you look at months such as September 2021, you can simply get a snapshot and look to see that 42,000 unvaccinated adults passed away. And you can look at that, Diane, over the course of a year, make these estimates, and it's awful. There's recent CDC data just showing that an overwhelming majority of children who were hospitalized during the Omicron surge were unvaccinated. This has been the reality since they were rolled out and we began tracking this data. And you can expand this on a wider scope with vaccines in general. The CDC has estimated that in the last 20 years, among that cohort of people born, vaccines worldwide have prevented 21 million hospitalizations, 700,000 deaths. This number is only going to keep increasing as more people continue to say we're not getting vaccinated and the virus continues to spread. As of right now, there are 55 million Americans who are still saying no to the vaccine, even though we have very clear data that it can save your life.
Now, health officials are also reporting a dip in the vaccination rate for kindergartners. What kinds of concerns, you're a pediatrician, so what kind of concerns are parents voicing to you as they consider whether or not to vaccinate their kids?
I think the most important thing for people to understand is that there are multiple concerns. We often just point fingers and say it's all misinformation amongst parents, but that's not necessarily the case. There are some parents out there who simply think that children don't need the vaccine. And they say this is not necessary because we keep hearing that children are a lot less likely to become hospitalized or get ill. There are parents who think the vaccine has very bad side effects that outweigh the benefits of the shot. So I think it's important that we recognize that there's a mixed bag here. For me personally, what I'm hearing the most of are parents worried about myocarditis and parents saying that we simply don't need the shot. And we have data showing that the risk of myocarditis is extremely low. That's that heart inflammation. It's very low in comparison to the risk of your child getting hospitalized. And as we talk about rolling out a vaccine for kids under the age of 5, Diane, we need to remember that the vaccine is already approved for kids age 5 to 11, and about 30% of those kids are vaccinated. And I hear this every single day from parents saying, we haven't gotten our child a shot yet. We didn't think it was a big deal. And we have to get on top of this heading into summer or fall because we just don't really know what's going to happen. And we can't get there unless we're very transparent about what the vaccines can and cannot do.
And so when do you expect we will see a vaccine for kids under 5 who aren't yet eligible? And how do you try to get parents to buy in if you're seeing this level of hesitancy for the 5 and up age groups?
Well, I don't want this to turn into an hour-long TED Talk because that is a big topic. But according to what we're hearing right now from Pfizer and Moderna, we're hoping that it's going to be about June when they're approved. Now, we already are seeing this frustration and misinformation kind of spreading and people losing trust in the actual process because it seems like the reason being given is that the FDA doesn't want to confuse people with 2 shots being released at 2 different times with 2 different regimens, when in reality, we should just be very transparent and saying, here is what's happening with Moderna's shot. Here is the effectivity. It's a 2-dose regimen. Pfizer is 3. Here's what's happening there, and parents can make the best choice for themselves. And I think we really have to get ahead of the curve if we're going to combat that misinformation. I mentioned earlier, we need to be clear about what vaccines can and cannot do. Some people out there have lost trust because they say, hey, the vaccines now do not prevent you catching SARS-CoV-2. The immunity wanes because antibody levels drop. When all along, what we wanted the vaccines to do was prevent severe hospitalizations and deaths. And that is what they've done. That is what they continue to do.
All right, Dr. Alok Patel, always great to have you. Doctor, thank you.
Thank you, Diane. Happy Monday.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.